So Thomas, welcome to our podcast about physiotherapy. I was looking forward to this because I think physiotherapy is for many people not so well understood how it works, including myself. Before I started it, I didn't know it. What the benefits are for the whole body, for the mind, and for the well-being. And that's why I'm looking forward today to talk about it with you. Can we maybe start off by a quick introduction by yourself, telling us who you are, your background, and a little bit about yourself?
Sure. So, hello everyone. My name is Tomas Oppl. I just want to say that all my life I want to be a sportsman, not a physiotherapist. But in past, I did play basketball a lot. I thought that I will be a professional player, but I was not so good, and luckily I broken my leg, and then I got a lot of physiotherapy, and that's opened the door to the physiotherapy world, and it showed me that physiotherapy is what I want to do. Yeah. So, and I want to do it better than I get my therapy, because it was always just in the state healthcare, and they didn't have enough time for me, so it was just 15 minutes appointment and no care personally. So I started to study first physical education and sport, and then since I was working in the non-state healthcare, I participate in many professional courses about the physiotherapy, and start to get more and more education about the physio, and I see that it's possible to do it a different way than in the state healthcare. So physiotherapy is quite interesting part of the medicine. It's firmly tied with some other departments, with orthopedics, with chirurgy, with general practitioner, but also with a psychiatrist, and with many other departments. We are cooperating across all the medicine with everybody.
And you've done it already for almost 20 years now. You're in the field, or you're in practice.
Yeah. It's not already 20 years. It's only 20 years.
20
Because it's not enough to know everything about the personal humans, and every time I study something new about the human body, and the new courses open my view for the patients, and it showed me that I have also what to improve the attitude to the patients, how to do it better,
Sure.
how to be a better therapist. Yeah, so
Which is fascinating to be able as a patient to engage in someone who is so passionate about it and so much educating himself that you're growing alongside the patient and their needs, and you probably get inspirations from different fields. So tell me, as a patient, because I'm a patient of you myself. We all patients, but it's often misunderstood, especially where I come from, Germany. Physiotherapy you get prescribed by a doctor. Usually in the setting you said like 15 minutes sessions, and you usually go when you had an accident or you had surgery or something like that. You get 8 sessions of 15 minutes, and you get taught some exercise or whatever, but it's not a kind of a deep relationship or like a patient.
It's quite similar like in Czech Republic. If you go to the state healthcare, so they'll give you also a 15 minutes procedures.
Yeah.
They have to do many patients a day, so
of course.
So they has no time for give you more time than 15 minutes.
Of course.
But the physiotherapy is also about the prevention, diagnosis, and treatment. So nobody's healthy, so
yes.
everybody has some diagnosis or can get some diagnosis. Even the kids are growing, so there is some growing disorder. Of course, the patients after some trauma, injury, surgery.
Yep.
So this is the group of people which are trying to care about.
Sure, because of course to enjoy life, you need to have a body which is not aching, which is not limiting you. So it could be people who play tennis, who play golf, and they get to a phase where they're not enjoying the game anymore because they have elbow problems or they have problems with spinal problems or something like that. They would typically contact you and ask you for help to get better, to get more optimized way of doing the sport.
That's what the physio can do, can give you and maximize your abilities and kill the pain or improve the range of movement and muscle strength. So that's what is also interesting on the physiotherapy. It was like in past, the doctors usually will tell you, okay, if the shoulder hurt you when you play tennis, don't play tennis.
Exactly. This is my point. Now
the doctors are more open to the alternative treatment, and they're sending the patients for a physiotherapy.
Absolutely.
And they see that the physiotherapy can also work instead of the medication. Can give you some like a local treatment. You don't need to take a painkiller because there is some other options like physical therapies, like laser, ultrasound, electromagnet, and shockwave, and the others. And it can be really much more beneficial than the painkiller or muscle relaxant, for example.
Because I guess you treat the cause, no? You were with a muscle relaxant or with a painkiller, you just numb the symptom. And here you kind of reinstate the healthy body function.
Exactly. So the painkiller, for example, the muscle relaxant, I want to say, first relax your muscles which are weak already relaxed. Then it relax some like phasic muscles, and then the hypertonic muscle. First tonic muscle and then the hypertonic muscle. So that's what the painkiller do. So you feeling like a jellyfish afterwards. But with the physio, we can focus the physical therapy, for example, for some part of your body or muscles, and we can relax only the muscles which we want to relax.
Which is great because at Concierge, we're trying to tell people that we want to focus and help them to extend their health span. And the health span means the number of years you have left and you have available in your life where you are not only living, but you're healthily living. You can enjoy time with your children, you can enjoy time with your grandchildren, and you can enjoy your hobbies, and you're not like 60 and you cannot walk anymore. So this is where I think this it's a fascinating topic to tell people how much they can do to improve their life and their enjoyment of life.
Yeah. In the other side, I want to say that the physiotherapy and the sports lifestyle cannot prolong your years, your life, but can prolong the good years.
Exactly. That's
all what we want to have.
Absolutely.
Good years as long as possible, active part of the life.
Absolutely. We don't want to be 90 and in a care home and unable to walk and enjoy life. We want to be able to function. And this, I think, if doctors work with physiotherapists, with nutritionists and with other disciplines, it can really work magic. And of course, interestingly enough, you're not only focusing on physiotherapy, but you're also trained in nutrition, or you're also a nutrition therapist or advisor. So how do you pull the two together, and how do you?
It's all related. Same like I said, it's firmly tied with the other departments of the medicine. So the nutrition I use almost for everyone, because if somebody has overweight and feels some pain in the knees, or obese patients has often back pain or knee pain or hip pain, so they need soon the surgery. So they need to lose weight first, and then they can get better or lose the pain of the muscular skeletal system.
And do you always manage that your patients who want to lose weight, that they do lose the weight?
More or less nobody is happy with the weight, and I don't know any guys which doesn't want to look good or better.
Sure.
Even the people which are like models, they are almost happy. But they want to be better always.
But often they don't have the right tools to lose weight, because I remember back from Germany, doctors simply told you have to eat less than you burn.
That's a general like a recommendation.
Yes, but it doesn't always work, no? Because
but it's not always true. Sometimes you eat nothing and you're gaining weight.
And why is that from your experience from the nutrition side?
You need even the energy for losing weight. If you don't have enough energy, or whatever you see or you eat, so you keep it in the deposit because the body is afraid to lose weight because there's a bad time for the body. So whatever you eat, it's safe in the deposit. So the man has usually the deposit on the stomach and the women on the side, on the thigh.
So that means by eating more, I could lose some of my stomach fat?
It could be possible,
And how do I know what is my...
More means also more healthy, let's say. Sure. Maybe more often, but the volume can be less. But we have to eat as variety as possible. Of course, not everybody can eat everything. Somebody has allergies or intolerance for the food.
Sure.
So there is some limitation. But as variety as possible is a key. There is like another recommendation to eat like as late the day will be, as less energy you need. And the biggest source of energy is the carbs. So eliminate the carbs at the evening, and it can be also good for you losing weight.
And do you believe that a glass or two of wine is actually healthy and is beneficial? Or do you think people who are serious about losing weight and living healthy, they shouldn't drink alcohol? What's your personal and what's your nutritionist view on this?
All the alcohol is a sugar, it's a carbs, so it's an energy. If it's too much energy, so your sleeping quality will be worse, and the sleeping is important for your living, for your lifestyle and regeneration. Yes. And if it's small portion, it's all right. It's individual, approximately, I want to say 1 glass of wine. And healthy impact is none, but mental impact is huge. So it can be part of your day, like a ritual that you calm down and you just get relaxed, with this, and it can help. But for the losing weight, it's not working as well.
It's not working, yes.
Not at all.
Yeah. And of course, calming down alcohol can help, but there's other very interesting ways, and we talked about it before. There is the breathing. Do you want to tell us a little bit about the breathing, because it's something you very much like as a topic, and you incorporate into your patient.
This is something what you do every day, breathing, and you do it at least 22,000 times a day. So
is that right? 22,000.
And most of the people are over breathing. So we are breathing too much. We're breathing through the mouth. I'm trying not to now because I'm a little bit more educated than I was a couple of years ago. So nose breathing is a very important. That's for what the organ is there, the nose, and the mouth.
Which you told me before today, and it's actually a very eye-opening sentence that the nose is for breathing.
I'll try to explain you a little bit how it works. Please. We having a saturation of the oxygen in the blood from 96 to 98%, which is normal. And if you breathe more, you cannot oxygenize the blood more than 98%. Yes. So even if you do a hard workout, you maybe 25% of what you bring, you are exhaling the carbon dioxide, but you are not improving the oxygen in the blood. And if you lose the carbon dioxide in the system, you cannot distribute the oxygen to the cells, because it's important to have about 5% of the carbon dioxide in the body, and then the hemoglobin is not sticking the oxygen and start to release. So if you breathe less, you are oxygenized more. So it sounds like a paradox.
It definitely sounds like a paradox.
But one example, for example, if you blow the balloon and then you feel a head spinning or headache.
Yes.
Most of the people will think it's I'm over-oxygenized my brain, but it's not. It's deoxygenize the brain because you breathe more like...
You press, and
you're losing too much carbon dioxide, and then you cannot release the oxygen into your cells. So all the veins are not leading the oxygen to your head and brain. So that's why you feel headache or head spinning, tiredness. It can be caused for many things, and some people who has asthma, for example, they can get worse when they laughing 30 seconds, for example.
They got worse.
So because they are exhaling too much carbon dioxide, and they start to have problems with the breathing because the oxygen is not going to the cells. Yeah.
Can you show us the example of?
There is a few simple exercise what you can do. First of all, I want to say start breathe with the nose. Like don't overeat and don't overbreathe. Yeah. So this is a key what you can change in your life.
And by the way, I did this today after you told me this morning. I tried to be mindful about my breathing.
Yeah. And you will see the effect almost immediately. In a few days, you will feel much better. And there is some recommendation is a breathing like a square. So you just do a small inhale, low volume, low speed, then hold the breath, 4 seconds, 5 seconds, and then you do slow exhale like a square, and then you hold the breath 4 seconds, and then inhale 4 seconds, hold the breath, exhale 4 seconds, hold the breath.
Let's do it. Let's do 1 round or 2 rounds.
Yeah. If you will be alone, you can do it always also like a triangle as well, not like a square, like a triangle, and you can hold your nose. So you inhale first, like small.
Okay, let's do it. Okay.
So inhale through the nose, small volume. So normal inhale, normal exhale, slowly. Then hold the nose and wait. Then leave it and inhale. Small, exhale, hold the nose. Leave it.
And this does now reduce the...
You reduce the breathing, and you will see what change you feel immediately. You will get warm, because you will super oxygenize the body. So same techniques use Wim Hof, get warm, so he's not going to the cold water and to the ice and breathing like dog, he's breathing very low. And
does he do the same breathing
reduce the breathing
when he goes
and more oxygenize? Yeah.
Because I did ice baths last winter, and I did the opposite, because on some video I saw that it helps you when you go into the ice water to breathe really fast. And it kind of took my attention. It's true, it took my attention away from the cold water, but I didn't feel energized afterwards. Yeah. And when I then started the slow breathing in the cold water, actually, or even before, it was much better.
Yeah, if you will practice this exercise, reduce the breathing, so you will get also high tolerance for a carbon dioxide. Then you will have your 5%, you will tolerate it, and you will not feel like bad. Now you can feel a little discomfort, but after a few days training, you will feel just better and better. Yeah.
Do you get the same effect, basically, as if I would go up on a high mountain? And
it can be a similar training in the
altitude,
higher way there.
Altitude, which is very popular for sportsmen and for people with breathing issues.
But the new test or new research show that it's better to like a sleep in the mountains, 4,000 meters sleeping, then go to the 1,500 for training, like a train very hard, and then go back for regeneration again to the 4,000 meters. This is the best effect of this kind of training.
But this probably is used for people with low hemoglobin, where it's really like where you need to have a real boost, not just get a little bit of a better well-being. But
not every one of us can live in the high mountains.
Sure.
So this training you can do everywhere. And
which is the beauty, which is very simple.
Yeah, very simple. Everybody can do it. You don't need anything. You can do it everywhere, a couple times a day. Yeah. Even you can walk like 5 steps and then inhale, exhale, walk 5 steps, inhale, exhale.
Or when you walk with the dog or whatever.
And you can prolong the distance. So after a few weeks, you will walk 80 steps and then inhale. You will see like how fast you will get better.
So you walk, you count your steps, you inhale.
So you start first week with the 5 steps, and then next week you can do 10 steps, and every week you will. So
you walk X number of steps, inhale as much as you can.
After exhale, you will hold the breath.
After exhale, okay, understand. And is this also because, of course, we have many clients who have stressful jobs, who have days where they're under a lot of pressure or whatever, is it also a technique which can help them to manage their stress, their
reduce the breathing, always decrease the anxiety and depression as well. You know, it also works with your brain a lot, so you can calm down immediately if you will start to breathe slowly.
Could be even a fun group exercise if you have a group of executives in a meeting and they go through a tough day or whatever, that the leader takes them through a number of if they feel they get to a point where it's getting really stressful, to take a time out and do the holding the nose exercise. And I think it's a fun and effective way to...
There exists a couple of the courses which you can join and learn how to breathe. Like in 1 week, they will give you a perfect education about the breathing, and then you can...
You mean as a therapist or as a user, as a breather,
as a special breathing couch, you know, which are doing it. So,
okay. And it needs a week to
because
internalize
they
it?
do also the Wim Hof techniques.
Yes.
So they get used to cold and they start to breathe and meditation. So it's all together workings with your mental health as well.
And do you believe in the Wim Hof notion of the ice water, like helping you to reduce inflammation, to shorten the time of sore muscles after exercise, or even as a healing?
It's evidence-based. You know, it's working very well, and the people which are getting used to be in the cold water, so they are no sick. You know, and at the winter they are fine if they still do it, because each of us are doing it in the summer. We are going to the air-conditioned room and then we go outside where it's 20 degrees different. We go to the swimming pool, which is also 15 degrees different. You know, so this is a similar technique, not extreme, but similar. And the first, like September, October, the kids are healthy, but afterwards, the immune system going down, because they are not continuing this technique.
I totally agree with you, because I started this routine last year. I was in Estonia, in Tallinn, up in the Baltic Sea in November, and we all went to sauna. And after the sauna, they offered us to go into the Baltic Sea, and it was like literally frozen. And there was like ice swimming. It was not frozen, but there was ice swimming, and I could till that time not imagine going into ice cold water, and I did it. And from that time, I kind of started to do it regularly. Of course, I didn't have the Baltic Sea in Prague, but I went a couple of times into Vltava, and I went a couple of times into like cold pools or ponds or whatever. And on top of that, into sauna, where they also have this cold plunge. And if you do that regular, you're absolutely right. You don't get sick anymore. Yeah. So I didn't have a cold the whole winter. And usually, of course, you usually have 1 or 2 times where you really go through a prolonged period of. So absolutely, I absolutely subscribe to this. That this is a great formula to stay healthy.
Yeah, I think it's one of the most important pillars for your lifestyle. You know, so
definitely.
It's supposed to be there.
Definitely. One more question about the traditional, or like the physiotherapy. How I used to picture it when you have an accident or when you have a surgery, there's always, I feel, 2 different schools. The one is start with physiotherapy and movement and exercise pretty much straight away as soon as you can leave bed, which should nowadays, some doctors tell you, be on the day of the surgery or the next day of the surgery. And then there is the more conservative notion of wait 3 weeks until the body heals and then start slowly with physiotherapy and so on. What's your view? And is the one right or the other right, or does it depend on?
It depends. It's a very individual, case by case. You know, so some patients can start immediately. Or usually we start the physio after surgery when the stitch is out, but we can start even earlier, you know, to do some preparation, pre-medication, you know, and then we can do the active physio later in 3 weeks from surgery. You know, but some injuries let us work immediately after the injury. For example, if you hit somewhere and it hurts. So what you do? Usually you kind of massage the place, and you do like a physical therapy for your tissues. You improve your blood circulation. Immediately you feel some pain relief, because you speed up the blood circulation, which is always good for a recovery.
Of course.
Faster.
Even I do it now sometimes at home when I have a pain in my shoulder, for example, that I'm lying and rolling on a tennis ball, which is
spontaneously you found this help. So
exactly. It was kind of something I thought could help, and I did it, and it felt well. So I kept doing it. So of course, yes, the body reacts to the physical. Touch and the physical
it's a
intervention.
Physical energy,
Yes.
Which is going to work on the tissues and cells.
Yeah.
It can be warm, can be pressure.
Yeah. And tell me, we talked about it quickly about the shock wave and ultrasound and the laser.
The physical therapies.
Yes. Can you describe for me what is used for which situation and what it does to the body and why it helps? What's the idea?
All these physical therapies has some effect which are similar, but some of the physical therapy has one effect which is a dominant. For example, one has more for the anti-inflammatory, one is more against the pain, one is more for the muscle relaxation. So the laser therapy is like a biostimulation of the tissues. So
I guess that's the most gentle one, no? If you want a gentle, kind of non-invasive kind of...
much less contraindication than the other physical therapies. And laser you can use even for like a joint replacement, because the implant is inside, doesn't matter. The metal is no problem. You can do it for newborn babies. You can do it for 100 years people. It's really not a problem. It has just some rules which you have to keep safe, because its only danger is for the eyes. So all the patients and therapists supposed to wear the special glasses and protect the eyes, and then we can do it. Of course, another contraindication can be epilepsy, or it can be some tattoo, or some places which are absorbing more.
So the tattoo would be basically only on the spot where you have the tattoo that you cannot use the laser, or you cannot use it then on the whole body, because there could be some...
Only tattoo place we cannot
only
laser,
tattoo place.
because it absorbs too much
Right.
and it's warm and it can burn the skin, let's say.
Sure.
And also, like I said, it works like a biomechanically, so it push the body, speed up creation of the collagen, so make your tissues more elastic and flexible. So it also help for a range of movement.
Okay, Thomas. So now that you explained to us how the different machines work, like the laser and the shockwave, and actually it's one machine combining both. We thought we come to our clinic and you show us on me as a patient how this works, and then we go back into the podcast and continue with our conversation about the physiotherapy.
Sure.
Sounds good?
Yeah.
Okay.
So the laser therapy, it works like biomechanically on your tissues, on your cells. It's supposed to speed up creation of the collagen and other process of the regeneration in your tissues. It's a very gentle procedure, and it's non-painful, and it has almost no contraindication.
I just wanted to ask if it will be painful.
Yeah, it will be not painful at all. It's just a light, and only, like I said in the podcast, that we supposed to just ask the patient if we have to exclude the epilepsy. You don't have any, so we can do it.
And I shouldn't look directly into the laser, you said, no?
Yeah, and it's the only danger place is the eye, so we cannot put it directly around the eye. So that's why we use the glasses for it.
Yes. And shall we start with you explaining the machine a little bit, so that we know what I'm facing here?
This is one of the best machines which we can have. The laser is the second most strong laser which exists on the market. But the experience showing that the stronger laser, it's more effective for the body. But the strongest laser only short the time, make a shorter time of the lighting of the patients. Yeah. So this laser is strong enough. It's a laser class 3B, so which is the second most strong laser on the market, which we can get.
And this menu there, which looks a little bit like an aeroplane cockpit, what can you select here? What is the programs, or what are the different?
There is a list of the diagnoses which we can
so you can actually
choose.
Pick the
and there is already preset some intensity and time which you use for the diagnosis. So you have a troubles with the elbow, for example. So we can do elbow. So
tennis elbow, despite I'm not playing tennis, so we're gonna look at it.
So there is a diagnosis epicondylitis, so which is attachment pain in the elbow. So we can do just the light on the right place here on the attachment.
Great.
Yeah. So please lie on your back.
Thank you.
So glasses for you. You can lie a little bit higher if you want to. Everybody in the room needs to be covered by the glasses, not the rules, because there is some reflection places like a mirror or some reflections. So, but I will be careful. So the laser is already preset, and I can just turn it on the laser machine. So I will not need any other move. So there is the attachment on the elbow. So it's already running.
That's it?
Yeah, that's it. You feel nothing. Like that. I'll do it on the one place only. Okay.
And how long it takes till I feel now that I'm like newborn and the elbow is better?
After the first session, you have to feel already better, because the creation of the collagen will give you a better mobility immediately. Immediately.
Okay, yes, of course.
So even for a cartilage or for a skin, it could work for wrinkles as well,
Good to know.
Yeah, but it's danger because the eyes.
Okay, yes, sure.
And shockwave therapy is a mechanic therapy. Is like if I say is a mechanical destruction of the tissues, like by hammer. So here we have a shockwave therapy machine. There is two types of the shockwave. We using here the radial shockwave therapy. The energy is creating in the gun. There is a projectile which is making the impacts to the head of the applicator, and through the applicator is going under the skin about maximum 6 centimeters deeper down to the tissues. The shockwave therapy has a few benefits for the body. One is like a spasmolytic, the muscles are getting more relaxed afterwards almost immediately. Also it's a painkiller, analgesic effects, and like a metabolic system of the cells is also going faster. We use it for attachment pain, like a tennis elbow mostly. We also use it for diagnosis like a bone spur, and we can use it for much more diagnosis. This machine is from the Czech brand BTL, and it has some like a library of the diagnosis, so it's very easy to preset. So every time I preset some diagnosis, so there is already preset the intensity and the numbers of the shock waves. So then it works like a machine gun, and I can apply it to the tissues directly through the ultrasonic gel, which is transferring also the sound waves.
And why is it good to use a hammer on your tissue?
Okay. So there is preset some intensity. How is it? Does it work? Does it hurt?
No, it's actually pleasant.
It's a pleasure. At the beginning, the pleasure. Okay. And it's also because we don't have a strong inflammation. I go around. Around the attachment. You don't need to be afraid, because afterwards it will not be painful. But during the application,
my dentist tells me as well sometimes.
Divine.
why is it good to use a hammer on your tissue?
Your tissues are getting more like a spread, and they are not so tight, so we can use it against the muscle stiffness, but more or less we use it for attachment pain, like a tennis elbow, like a frozen shoulder, and we can use it for the hips and knee as well. We often use it for the bone spare. We can like remodulate the bone and the tissues around. So it's also very beneficial. And we use it, the shockwave, usually for the chronic pain patients. Like if the pain is there more than 3 months and no other therapy works, so we use the shockwave and it works immediately.
And what's your personal experience? How often does it work and how often does it not work to reduce people's pain?
I guess about 70% of my patients get better after third session of the shockwave.
That's very good.
And the other 30 get better later.
Okay, so everybody gets some relief of the pain.
I would say I never had a patient which didn't get better at all. Everyone get better, and I hope most of them got completely okay for 100%.
Which is a great. We talked about it before. Which is a great kind of position to be in, to get up every morning and know you go to work and you help people. No, it's like you make them, you help them getting better. You improve the quality of life. I mean, I guess there's few professions, and that's why I like our field so much, where you can make such a difference in people's life.
I dare to say there is no better feeling than help the other people to get back on their feet, So,
yes, definitely.
So you must feel very satisfied, or I do feel very satisfied to help them, So, and I see the work behind me immediately. In few weeks, the people on the crutches, they walk again, jump and dance again, So back in the normal life.
And I guess they stay with you a long time, no? You must have patients or clients who come back again and again, or come like all the time. So I guess
some of my patients are coming regularly for prevention, time to time, and I know them years. I know some patients from the 3 years, and now they are like adults already, So it's also nice to see them. Their life,
definitely.
How it's going.
They told us in business school that as a successful person, you need a lawyer you trust, you need a banker you trust, you need an accountant you trust, you need a doctor you trust. But I think now, definitely you need a physiotherapist you trust.
Yeah, more and more. Sooner or later, everybody will need our service in physiotherapy.
Absolutely. Great. Thank you, Thomas, for fascinating insight into the world of physiotherapy and more around
my pleasure.
The breathing, the nutrition, and very nice learning something. I always enjoy talking to you because I always learn something. And wish you a nice rest of the week, and keep up the joy of helping people, because that's what makes life different.
Yeah, I'll do my best as usually.
Absolutely. Thank you, Thomas.
You're welcome.
Great.